Hi, my name is Joe Romano, and this is my presentation for functional biomechanics. The goal today is to improve the technique of changing direction to make it the most effective. The movement and analysis is change of direction. Change of direction is considered the ability to maintain controlled body position and rapidly change direction without a loss of balance, body control, or speed. The most effective method for this movement is to decelerate into a lowered center of gravity by bending the hips. Then the athlete should transfer weight towards the intended direction, and finally, similar to a start of a sprint, drive off the intended leg in that direction. The most critical component of this presentation is to understand what we are looking for in a perfect movement. Here we will see a picture of the ideal position in the most critical part of the change direction movement. We begin breaking down this movement and investigate what makes up the most efficient and effective movement while changing direction. Let's begin by touching on what we look for in a perfect movement. The subject of today's analysis is a 24-year-old female recreation soccer player. This athlete is looking to improve her soccer skills. She has straight line speed and is top-notch at getting to it. However, her ability to sink her hips and change direction is lacking. When we look at a perfect movement and change direction, there are 6 critical components to the movement. The first being deceleration. We want to see the athlete slow down by sinking the hips and bending the knees, the next 2 components of a perfect movement. Then the athlete should begin to transition the center of gravity towards the intended direction. Once the weight is transferred, the next step is to drive off the bent knee with an exaggerated knee drive in the opposite leg. Finally, and perhaps the most overlooked aspect in changing direction, is little to no wasted movement. There is a reason why the previously seen picture is considered the perfect form for changing direction. These fundamentals of movement occur for a reason. First and foremost, by changing direction in a decelerated position, the athlete is decreasing the joint load and optimally positions the center of gravity. This helps in decreasing injury and improves proprioception in the athlete. Lowering of the center of gravity allows the body to transfer the load into another direction without losing speed. As we spoke earlier, this is the exact definition of changing direction, to move without losing speed. Finally, this movement utilizes the stretch shortening cycle with the high forces being driven through the legs. This cycle allows for those high forces to be regenerated in the muscle and produce explosive movements. That is something seen quite frequently in a bench press movement. Now that we've discussed the critical components of the movement and fundamentals, we will dive into why this movement pattern is so effective. Let's start with why we sink the hips and lower the center of gravity. This movement decreases the shin angle, decreasing the risk of injury on the anterior portion of the knee. It also allows the body to decelerate, which allows for transfer of center of gravity. This position will allow the athlete to disperse the ground reaction force associated with high-speed running. After this position is reached, the athlete will begin transferring weight. This decreases the shear forces on the knee, again reducing injury and not having the athlete in a compromised position. Finally, the athlete drives off the leg similar to that of a straight line sprint. This allows them to increase speed at the quickest rate and lose as little speed as possible when changing direction. There are 3 phases of the change of direction movement. You can probably tell already how this is broken down. The 3 phases of the movement are deceleration, body positioning, and acceleration. The first step is deceleration. This occurs with properly lowering the hips and bending the knees. The weight is back on the heels, again lowering injury risk to the anterior knee. The hips are low with the chest up and neutral spine. The steps into this movement are quick, soft, and driven on the heels. This allows the athlete to understand body position as it relates to speed of movement from a correct anatomical position and limit ground reaction force. Finally, there is no movement vertically and the upper body is relatively still. The second part of the movement is broken down to be considered the body positioning phase. In this part of the movement, the athlete is in a decelerated position. From there, the transfer of the weight towards the intended direction occurs, which allows the other leg to straighten. The knee on the leg of the intended direction begins to bend deeper. This movement looks similar to a side lunge. This allows the athlete to be in a ready position and begin to accelerate back up without losing speed. This is the hardest part of the movement to evaluate, as it's quick and not easy to capture. It allows the athlete to complete the movement in a position that does not put them in a position to be injured or lose speed. The final part of the movement is the acceleration phase. Once the weight is transferred, the athlete needs to re-accelerate to begin their run in the new direction. While accelerating, you would like to see the athlete drive off the leg that is closer in the intended direction. You'll notice that this is extremely similar to sprinting. That is because essentially the final part of changing direction is a sprint. Like the other phase of the movement, the athlete should be limiting weight steps. Where athletes struggle is by overstriding or chopping their steps. In the next few slides, we'll look through the subject's movement and begin to break down her technique. Faster and widen your stop. Much better. Take a couple steps over this way.
Huh?
Take a couple steps over this way.
So I tried to do it in the beginning, so they could see me. No.
In this screenshot of the video, you can see the athlete beginning the deceleration phase of changing direction. The athlete has begun to sink her hips, and as you can see, the weight being distributed towards her heels. She is beginning the movement as she approaches the point of the tennis court that she was aiming to change direction at. The only critique you may see of this portion of the movement is a slight increase in shin angle. The athlete should be sinking her hips slightly lower to allow her center of gravity to be easily transitioned. In this screenshot, you see a different angle of the same position. From this angle, you can see the athlete's knees bending and hips dropping. Again, you would like to see a more exaggerated bending of the knees and sinking of the hips, but the athlete is beginning to get into the body positioning phase of the movement. In this next still, we look at the body positioning phase. This may be the hardest portion to capture. In this first still, you can see perhaps the first big mistake she makes. The athlete is beginning her directional change before full transitioning her weight to her left leg. This may seem like a small error, but this small error can cause the athlete to lose valuable speed in changing direction. There is certainly a directional shift in the weight transfer, but it is not enough to warrant the athlete to change the direction of her head and shoulders. This still from the video is a little better, but the same problem persists. This shot, just like the previous one, you can see the right leg is straight and the left leg is being used to drive off of. This run through the drill would warrant a quicker time because of this, but to truly correct her technique, the athlete would need to keep her head and shoulders square until the moment her direction changes. The final portion of improving the athlete technique is in the acceleration phase. This phase is very similar to a sprint. We are looking for the athlete to be at an angle with a high knee drive and explosive arm action. What we see in the first capture of this video is the athlete's acceleration. As you can see, she has a good knee drive and good arm action. Aside from a lack of complete knee drive, the athlete is also not at a small enough angle. The angle is important because it allows the athlete to keep their momentum moving forward and limit vertical movement. In the second still from the acceleration phase, we can see a higher knee drive in this capture. The athlete has proper arm action, though one may argue the elbows being pointed out slightly is an error in technique. Again, as in the last image, the athlete failed to maintain a proper acceleration angle. With an improvement in the angle, the athlete will be able to get back to top speed quicker than staying upright. From this point forward, the athlete moved back into a run and completed the change of direction movement. In conclusion, we look to get the most efficient movement for two reasons. The first being to reduce injury. This is especially important in females as they are predisposed to knee injuries, which are the most common injuries seen when investigating change of direction. That is because during the deceleration phase, high forces pass from the ground through the legs and focus mainly on the knees. Another reduction in injury rate is to the ankles and hips. Without a proper shift in weight, the ankle and hip gets pulled into compromised positions and can lead to a variety of musculoskeletal injuries. The second reason we look to improve the technique of this movement is to increase performance. The best change of direction movement eliminates the time spent in a stationary position, allowing the athlete to move at a quicker rate throughout the entire movement. The quicker an athlete can change direction will directly relate to athletic performance in any sport in which an athlete must simply not run straight. To decrease the injury rate and increase performance, it is extremely important to emphasize proper technique and the most efficient movement. I hope you now understand what that movement entails.